Dr. Gregory Zengo currently serves as the Medical Director of New Image Medical Aesthetic Center in Georgia and as the Medical Director and an instructor for Practical CME Training Institute in Florida. Dr. Zengo attended medical school at Emory University in Atlanta and continued his residency at Emory and Grady. He has spent 8 years as an assistant professor and clinical instructor on the Emory faculty. Dr. Zengo has trained hundreds of physicians in a wide variety of aesthetic procedures, including vaserlipo in an office setting. He has forged a unique blend of rigorous evidence-based instruction with practical tips, tricks, and hands-on techniques to help the new practitioner become experienced in a short period of time. Please welcome Dr. Zengo.
Well, thanks a lot, and welcome to Wide Awake Vaserlipo in the office. This presentation will hopefully take about 20 minutes or so. If we have any questions along the way, of course, go on ahead and type them in. And so let's get started. Christy, why don't we advance to the next slide? A little introduction about myself, although Christy did a pretty good job. I am currently based in Athens, Georgia, and that's UGA 7 up there in the upper right-hand corner. He's our mascot for the University of Georgia. So it's a middle-sized college town, and however, I first started my aesthetics clinic in 2001 in a town of 1,500 people, where I was only one of 2 OBGYNs in the city, and we slowly built it up from a half a day a week now pretty much to a full-time job. And I've been able over the last 3 years to quit obstetrics, quit all hospital duties, surgery, drop Medicare, and drop Medicaid, all because of the aesthetics and wellness services that we've offered, with, of course, vaserlipo being the #1 service of them all in terms of generating revenue. In early 2006, we added vaserlipo, and we performed somewhere around 150 cases, all in the office, all under local tumescent anesthesia. My other hat is I'm the Medical Director of Practical CME Medical Training. We're the only training course set up in the country that does both live courses all over the country, but also video courses for doctors who are motivated, who want to learn on their own. So for people who want to add weight loss or saliva testing and natural hormone balancing, which is a real hot topic among patients these days, you can even do it from home, and we will assist you with live webinars just like this one that we do roughly once a month. And there's our website, practicalcme.com, if you want more information. Next. So why add vaserlipo? Well, for us, it was a complete game changer. I mean, it was probably the most significant thing I have ever done to my practice from day one. It's a completely office-based procedure if you wish it to be. And you're not really going out on a limb when you do something like vaserlipo in the office. A lot of people have resistance to doing something like liposuction in the office, but really you are not pushing the envelope when you do that. This is a very safe, protocol-based anesthesia technique called tumescent anesthesia. It was invented in the mid-1980s, and we are following a set of published guidelines, which is what we teach in our training courses for vaser, from the American Society of Dermatologic Surgeons. So this is completely standard of care, and that's really important to realize, and that there has never been a death reported in the literature from liposuction with tumescent anesthesia when the ASDS protocols have been followed. Of course, it's complementary to almost any practice, no matter what specialty you're in, whether it's a traditional surgical specialty, anesthesia, ER, family practice, internal medicine, aesthetics, even wellness. And amazingly enough, in a wellness practice, and most of our office visits are for wellness services like weight loss and hormone balancing, those tend to be our best feeder services for liposuction because you really earn the trust of those patients when you can help them lose weight or feel better. And they go from being people who would never consider lipo to people who now have the confidence that they might want to consider lipo, and of course they'll go to you first. The demand for liposuction is increasing. It is the #1 surgical procedure with a bullet. It's not going anywhere. It's increasing very steadily this decade with absolutely no signs of decline. And in the most recent American Society of Plastic Surgeons survey, people seeking procedures like this, 71% make $60,000 or less. A number of our patients do finance. So realize, too, this is not just a procedure for the ultra-wealthy anymore. And 64% are under age 50. A lot of people think as you get older, you're more likely to have this, but the average age of our patients is in their late 30s. And 81% have never had cosmetic surgery before. So it's not like they're going to be going back, say, to a plastic surgeon who they've met before. People are very open-minded about where they're going to go for a liposuction kind of procedure. And I like this quote from Australia. Patients are now better prepared, more realistic, and less likely to be psychologically imbalanced than in the past. So gone are the days of the traditional liposuction patient or plastic surgery patient rather being a little bit out there with a distorted body image. You're seeing very regular, normal people with very realistic expectations, and with a technology like Vaser, you can meet those expectations quite easily. Next. Well, Vaser in and of itself, you've already got piece number one, which is the tumescent anesthesia in the office, which is very, very safe. Then when you add to that a tool like Vaser, which is a procedure that can really selectively remove fat in fairly large quantities in the office with very, very minimal effort on your part. What we see when we do Vaser lipo over traditional lipo and over a lot of the other new technologies is an extremely fast patient recovery, virtually no pain medicine required post-op. Meaning, most of my patients do fine on extra-strength Tylenol alone, and then by about day 3 or 4, they can switch to NSAID. Minimal with no bruising. I'll show you some photos. A very reduced need for retreatment. You will be very good at this procedure right out of the box because of the interesting way that Vaser makes it very easy for you to be very smooth and very predictable with your results. What I tell people is if you can color with a crayon and get it nice and even and stay within the lines, you can do a great job with Vaser. It's really not a whole lot of a different skill. Skin tightening, precision, reduced fatigue are all things that you get with Vaser over traditional sharp lipo. 100,000 or more procedures without any serious complications, and tremendous efficacy, tremendous safety in a wide array of different body areas. And the neat thing about Vaser is that, and I don't know if we're going to mention this later, but this is a technology that has been around for 6 or 7 years, and it has not undergone any major revisions. So this is not the type of equipment that we can say, you can buy now, and then 3 weeks later they're going to stop selling it and come out with the next latest, greatest version of it that's going to make yours obsolete. This has been basically the same equipment, the same probes, the same technique all along because they got it right from the start. Next. Here's one of my patients. This is a before photo. She's had 4 children, 5'10", and just wanted to get rid of some of that central abdominal obesity and also the fat kind of over the love handle area, over the bikini line. Now, this is a pretty big case. This is about as big a case as you'd want to do under local in the office. And it may not look that big because she's not that thick, but because she's tall, there's a lot of surface area to cover. And this is just an example of how we marked her out with concentric circles just showing our emphasis areas. And she's actually a model, and her days of being in vogue are over, but she does a lot of local campaigns in Georgia and travels somewhat, things like boat shows and photo shoots, magazine ads, and things like that. So she definitely wanted to look a little bit better in a bikini, and we were under the gun because she had a pretty big photo shoot in a bikini to do 3 weeks after this. Next. And that's her after photo, and you can see how incredible she looks very shortly after the procedure. This is a number of days after the procedure. I want to say this is around 2 weeks. I know it was before she went out on that photo shoot. And you can see she looks absolutely outstanding. We were able to hide her incisions under her bathing suit. And you can see on the right her fat canister. And it's a little tough because of the glare through the plastic, but we got out 1,600 cc's total. And if you look way down at the bottom by the 200 mark, that top column is all pure fat. And you can't do that with standard lipo. There's absolutely no way. And with the Vaser, it was very, very selective for her. So we had a really nice output. Now we're going to show you the side views. Next. Here she is before, and if you didn't appreciate how much of a bulge she had in the mid-abdomen area, now you can see it. But I want you to really focus in, too, on that upper hip love handle area and how it kind of bulges over the bikini. So take a good look at that picture, and now next, here's her after. Now this after is at 3 days. To give you an idea of what little bruising they have, and generally in cases like this, the most bruising you're going to see is right in that area in the center of the picture around the love handle, because as you're kind of coming around the curve, when you use your port in the front, sometimes you create a little bit of trauma on the underside of the skin. But this is amazing. You can never see anything like this with traditional lipo. And you can tell it's soon after the case because the Sharpie hadn't even worn off yet. But notice, even at 3 days out, there's no bulge over that bikini strap whatsoever. Next. Here's the back, and again, truly remarkable results. Patient about 5'4", 145 pounds. Had a tummy tuck already in the front, so her front looks pretty good, but the back just didn't seem to match the front. And you'll see that in the after picture to the right, this is at the 1 month mark, so you can see the incisions are still looking a little bit pink. Absolute home run. And again, not a lot of effort on our part because thanks to the Vaser. And so you see, this is the kind of stuff you can do. And by the way, you don't need much of a learning curve. That first patient in the bikini, she was probably around the 30th case I ever did. And this particular patient was only the 3rd back I had ever done. So again, the learning curve's pretty quick when you have technology like this. Next. Here's how vaserlipo works, and we're going to go over a lot of the physiology in schematics and in photos, just so you really understand what you're getting with a technology like this. So the first thing you do, of course, is you have to anesthetize. So you infuse the mid-portion of the fat with tumescent fluid, and what happens is as you're putting this fluid in under pressure, it's going to go upward, it's going to go downward, it's going to go left and right, and it's going to fully engorge this area, and you're going to fill the treated area up until it's about as tight as a drum with the dilute lidocaine tumescent fluid. And in our training course, we teach you all the ins and outs of mixing up the bag and how much lidocaine to use and all of that. Next. The next step is when you pass the Vaser probe in and out of the fat, and this prepares the fat for the suction phase. And the Vaser probe is a titanium probe with rings on it. You'll see it more up close later. But it hums at just the right frequency, so as it passes in and out of the fat, it creates damage selectively to the fat cells and disrupts the fat cells, but tries to leave the majority of the nerves, blood vessels, and connective tissue alone, because the vibration has an effect on the adhesions between the fat cell molecules but does not disrupt the tougher tissue that is connective tissue and nerves. Next. So now what we have is all of this emulsified fat suspended in the tumescent fluid. So you use a Ventex suction cannula, which is, again, another patented device by Sound Surgical. And these cannulas are blunt-ended with a little vent in the handpiece, so you don't have to pull the cannula out of the skin to release the suction and clear the tubing. You can keep working. And again, by having this blunt-ended instead of sharp, like typical liposuction cannulas, all you're doing in there is going in and removing the debris. And by passing in and out and removing the debris, you have some very definite endpoints, like when you stop getting fat back or you start seeing a little bit more of a blood-tinged discharge, you know you're done. A lot of people ask, well, how do I know how much vasering to do? Simply put, like I told you, you need to color that picture. And if you can color that picture and stay in the lines and make it even, the amount of fluid you infuse to a given area determines how much vaser time. So there's really very little guesswork. It's highly protocol-based, and that's what leads to the very consistent results. Next. Finally, with the fat evacuated, the patient undergoes a healing phase, and during healing, the skin retracts nicely, the area of fat and connective tissue remodels to give you that final appearance. And immediately post-op, we do request people wear a garment to compress both the remaining fluid and get that to leave out of the incisions, but also to give that ultra-smooth result. Next. Microscopically, this is how cavitation works. And really, a lot of people think that the humming probe actually comes into contact with the fat cells and vibrates the fat cells and damages them directly. And that's not the case. This won't work very well if you put it straight into dry fat. You have to have the tumescent fluid in there. And what you do is you take the bubbles that are already microscopically existing in the tumescent fluid, and by humming that probe, those bubbles vibrate. The bubbles get bigger and bigger. They start to coalesce. And when they get to just the right size, which is 180 microns, which is actually a size that is around the same size as a fat cell in a lot of cases, the bubble tends to burst. And the bursting of the bubble is actually the energy that separates the fat cells or bursts the fat cells. Next. So fat itself is made up of varying different compartments. And you see the fat there grossly on the left. And then within that fat, you see pearls of fat. And those pearls have a slight membranous border around it. Inside that, you'll see a lobule, and then a lobule is made up of a number of cells. So when those little bubbles are formed, they are separating the fat cells into little clusters of fat cells, or separating lobules into clusters of lobules. They are not just strictly rupturing the fat cells like water balloons, because we have found that in the vaser fat aspirate, the vast majority of the fat is still live fat cells. So it's actually just taking them and cleaving the fat cells from one large unit into many units of smaller groupings. But these smaller groupings are able to be easily suctioned out without trauma. Next. So again, here's another schematic of how cavitation breaks up fat. As the probe is passed in and out of this fat, the bubbles are in varying sizes. You'll see the big bubble there on the left is ready to burst. The other bubbles are expanding, and so the fat gets disrupted, and it allows the tumescent fluid to then get around the fat, create littler islands of fat, and then it makes it easier to suction out. So instead of that fat having to be ripped and torn out from its attachments, it's already become detached, and it's floating in just little islands inside the tumescent fluid. Next. Basically, fat cells are more susceptible to this kind of energy because they separate so easily. It takes very little energy to separate a group of fat cells into their components. Whereas the example I use is that they're like a bunch of water balloons maybe stuck together with a little roll of Scotch tape, whereas the blood vessels are like garden hoses. So if you go in there with a vibrating device, it's very easy to break up the water balloons and separate them from each other, but it's very hard to rip apart a garden hose. And so those bubbles act as little miniature tools that separate the fat cells, but all the blood vessels and fascia and nerves do is just kind of shake. So they don't really get damage from the ultrasonic action, and that's why it's so selective. Next. Grossly, here's an example. What we're trying to do with vaser is emulsion of the fat and removal of the liquefied results. And so you get a very selective result. You get very little pain, smoother contouring, easier use, better recovery. The top slide with avulsion involves ripping and tearing. So if you don't do the vaser step and go immediately to suction, you have a much greater possibility of creating grooves. And this is probably, in my experience, with doing liposuction with cannulas that are sharp, because the vaser is not the only thing I do or have done in the past. I found that when I was using the avulsion technique with just standard cannulas, that when you make a good pass and you get back a lot of fat, you're real proud of yourself. But then when you try to go right next to it and make another pass, more often than not, your cannula ends up going down the same tunnel, because everything wants to follow the path of least resistance. So if you're not careful, it's very hard to make a lot of parallel tunnels. You keep ending up in that same tunnel, and you don't know it. And so what happens is you end up with a groove where you've been 10 times, and then right next to it an area where you haven't been once. Next. Here's again another gross of an area that's been vasored and opened to show you the emulsified fat that is sitting there beneath the skin. So it was vasored with the skin closed and then opened to show you all the emulsified fat just waiting to escape. And then after suction with the Ventex cannulas, look at all the connective tissue that remains, and you can see, look at the right 3 bands in. You see that pink band? That is vasculature. And there are some nerves, there's connective tissue, and that connective tissue, when it retracts, is going to give you a big advantage for skin retraction than if you went in and avulsed and tore every single one of those connective tissue bands. Next. We're going to let this load. This is a demonstration on a piece of abdominoplasty fat that is wedged between a couple of glass plates. And what you're going to see is how how efficiently the vaser probe emulsifies the fat in between those two plates. It also gives you an idea of how we do the vaser strokes. And the vaser strokes are very long, very deliberate, very smooth strokes. Again, just as if you were going to take a crayon and try to color in a very large area nice and evenly. All right, and it's on my screen. I hope it's going on yours too. And you see the probe is moved gently in and out of the fat. You can see the liquefied fat dripping down from the bottom of the specimen. Look in this pass too, and this is going to loop. So I want again for you to see the next pass, and then I want you to watch this last pass very closely. Watch how it emulsifies both going in the fat and then coming out. As it comes out of the fat, the probe is still vibrating, and so you're getting it to work in both ways, in both directions. And I'll show you how that happens in a later slide, because that is very, very important. You're getting emulsification with both strokes, so you're getting really, really efficient work. Some other technologies which only emanate the energy off the tip won't give you as much work in a backward stroke as the vaser that emanates the energy off of both the tip and slightly off of the side as well. Next. Here's a close-up of the probes and the Ventex cannulas to give you an idea of what you get when you get one of these sets. On the left-hand side, you can see that the probes range anywhere from 2.2 millimeters up to 3.7 millimeters, and the Ventex cannulas range from a very, very small cannula for the face, which is under 3, and then the body cannulas are the next larger cannulas. They are 3.0, 3.7, and 4.6 millimeters. To be honest with you, in my practice, I almost never need the 4.6 because the 3.7 and the 3.0 are so incredibly efficient. Look at the bottom left of the screen, though, at the close-ups of the vaser tip. And this is why vaser is completely different than every other ultrasonic technology that has ever come before it. Now, I don't know if any of the attendees remember ultrasonic liposuction from the late 90s. But those probes were smooth, and they emanated all of their energy off the tip. So the tips got very, very hot. There was a lot of energy concentration there, and so burns were not that uncommon. The addition of the grooves, plus the use of titanium versus stainless steel, which is a much better conductor, allows the energy both to go off the tip, but also off of the edge of each of the individual rings. And that is a tremendous advantage. And that's why vaser gives such incredibly smooth results, because you can choose your weapon. You can pick a 1-ring, which will get you through tougher fibrous tissue, and then when that stage is done, you can switch to a 2-ring, spreads the energy out a little bit more, and finally the 3-ring, which is almost like a little can of spray paint. It's very broad in its effect on the fat, so you can do some real nice kind of final evening out with that. Next. So the benefits to you of vaserlipo. Obviously, you know your patients are going to be happy. There have been so many happy patients with this technology. But honestly, what's it going to do for you as we're speaking here doctor to doctor? Well, the startup costs are relatively low and the profitability is rapid. You know, a lot of us in this line of work, aesthetics and cash-based medical procedures, are very used to paying $100,000 or more for a piece of equipment. And you've got to think about, well, what is the return on investment for that piece of equipment? And if that $100,000 piece of equipment is going to be doing $60 upper lip hair removals, you're going to need to bring in an awful lot of people to pay that off. But with a procedure like this that is in such high demand, it's the #1 procedure, plus you're going to be making $3,500, $4,000 possibly or more per case, it is very easy to pay off this equipment. And when you look at it, really, you have already made your payment before you've even completed your first case each month. So hard to say that about a lot of other types of aesthetic equipment out there. There's very little operator fatigue, so it's quite possible to do multiple cases in a day if you wish to. You can remove very large amounts of fat with very, very minimal trauma. The learning curve is fast because it's very protocol-based, and it's highly desirable. You know, this is not just for those six-figure patients. It's not just for certain regions of the country. It's everywhere. And it's very easy to train. If you choose us to train for Vaser, you don't have to go and waste 3 days of your practice sitting and listening to a lot of boring lectures. What we do as soon as you register is we send you out an 8-hour didactic course on a flash video, which you can watch on your computer, and skip around to different slides and watch demonstration videos, and then we go over all your questions and answers in a live webcast. And then on selected Saturdays, either in the Baltimore area or the San Diego area, we have our hands-on, and you simply go travel for just the one day and do your hands-on. So for a lot of people, you will not miss any time from work, which is so important. Next. Setting up your office is real simple. A lot of people think, oh, well, what are all the costs of setting up my office? And really, this is all the major equipment that you need. Just about everything that you need to do the cases comes with your Vaser kit. But you will need a blood pressure monitor, preferably with a pulse ox. You do not need an EKG monitor. If you have one, that's great. Feel free to use it. But you're really not creating any cardiotoxicity or potential for cardiotoxicity during the case. So that's really not an issue. Nor are you giving anything that could result in a rhythm abnormality during the case. You'll need an autoclave with a dry cycle. You'll need some, of course, the sterile packs and drapes and the disposables that you'll need to make up the bags. I recommend somebody get a towel or a sheet warmer, and that little device you see in the upper right-hand corner is a $130 towel warmer that you can get off eBay that does a great job. You can even kind of heat your IV fluids in it, too, which really helps the patients feel very comfortable during infusion. And, of course, you need a good digital camera with a photo background. My pictures I took with a $50 floor lamp and a digital camera from 2002 that was about $140. So you really don't need anything fancy there. And you can do this in a regular 10 by 10 exam room if you want. Just use your countertop as your sterile instrument stand. If you have a larger room, then great. Then you have a little bit more space to play around in. But you don't need a procedure room. You don't need a big light hanging from the ceiling. You can do this in any standard office environment. Next. This slide is a little bit tricky. And I want to kind of show you how liposuction, especially when you use Vaser, takes your profitability per unit half hour to all new levels. And so let's look at the column labeled cost. What I have assumed, and this is typical of a fairly low-cost office in our area in Georgia, but we're going to assume that this office costs $96 to run every 30 minutes. And that $96 includes all the overhead, the electricity, the rent, the staff salaries, all the disposables that we go through, laundry service and the like, taxes and whatever, benefits. And we include a very small base salary for the doctor in there, too. So $96 every half hour. So that's your base cost. So you've got to say, okay, well, I need to make at least that $96 just to, make enough money to put food on the table. How much more than that $96 can I make? So then what we've done is we've said, okay, for certain procedures, let's add to the cost because certain treatments have expenses that are unique. So if you go into a room and do 30 minutes of Botox, the room may cost $96, but you've also got a $500 fee for the vial of Botox, so we would add that in under the cost column. So looking at some of the procedures that we teach, like mesotherapy, when you add in the cost of your training and an extra insurance and supplies, you get to around $143 is the cost of that 30 minutes. So if you can make anything you make more than that is gravy, and that goes right in your pocket. A sclerotherapy treatment for leg veins, $134. A hormone office visit, the cost may be anywhere from $96 to $276. Why would it be $276? Well, you may sell vitamins, or you may actually sell the patient a saliva test kit, and you have a base cost, a wholesale cost for that kit. Looking down at the bottom, of course, a regular Medicaid office visit. You're not spending anything additional to do the visit, so the cost for that room for 30 minutes is $96. Now let's look at the vaserlipo. And this is one thing that a lot of people will have some resistance to at first. And that is, oh, but it's so expensive. Yeah, that 2.5 hours. Now this isn't just for a half hour, okay? We just took the whole case and said the cost for that whole case is probably going to be somewhere around $990. When you count the cost of the room, the disposables, the garment, the cost of the vaser and warranty and all of that kind of stuff, that whole case is going to run you about $990. So now look at the next column, and this is the money you're going to charge the patient or get reimbursed. And you can see by doing the simple subtraction in the third column how much more money you're going to make for every 30-minute tick on that clock. So the mesotherapy treatment, if you can get $300 for it, not everyone can, is going to be an extra $157 in your pocket for that 30 minutes. Sclero, $161. A hormone visit, depending on how well insurance pays, you could make an extra $64. You could make even $200 or $300, depending on their insurance. And finally, what we all need to get away from, the stinking government insurance, you're going to lose money. In fact, you're probably not even going to get paid. You're just covering your overhead with that one. So that's why so many doctors have to cram so many more visits into a time frame. Now let's look at vaser. You're going to charge $3,000 to $4,000 for the case. You've attracted only one person into your office. So again, for that 2.5 hours, you only have to touch one person and get them into your office. If you're going to do 2.5 hours of sclero or meso or hormones, you need to touch 5 people and bring 5 people in, and that's harder to do from an advertising standpoint. So again, you're going to earn $3,000 minimum, $4,000, some markets even more, urban markets in the South. Every single half hour you are in that room during lipo, you are increasing your profitability that much for every single half hour. So you might say, well, hey, this case is a little more work than sitting around doing a regular office visit, but look at the difference. It is absolutely tremendous. And you will see that incredible change in your bottom line. It just takes your bottom line to a complete other dimension if you have not done any of these big-ticket services. You know, some med spas will charge $3,000, $4,000 for some things, but those tend to be packages, hair removal packages or photofacial packages. And so that profit is earned over time, providing a service over time. This is earned in one visit. Next. All right, well, now we've got 3 short clips, an infusion clip, a vaser clip, and a suction clip to give you a taste of what it's like to perform a case. If you do our course, you'll actually get a 1-hour-long narrated video on a vaser case, and many of the sections are unedited. Now, if you look here, you'll see her left lower quadrant is already infused. It is fully tumesced, and we put 500 cc's in there. Now, this is an infusion cannula, and we're already starting to pump some infusion in the left upper quadrant. See how blanched and full that lower quadrant is. And if you can peek to the right of the screen as they pan out, and you'll see the patient's face. She's completely unaffected by this at all. You see how we're infusing, and there's that firm column of tumescence, and as we advance the cannula, again, you'll see that tumescence extend all the way down to the navel. So now we have, look at this, almost a banana or a zucchini of tumescence running along where that cannula has been passed. So once it gets real firm, we'll go on ahead and redirect it. How do you know how much to put in? It's actually quite simple. When the skin becomes very taut to the touch, tight as a drum, you know you're done. Also, if tumescent fluid starts spurting out of the other ports and holes, you can't put any more in, so you know you're done. So it's pretty hard to mess up the infusion step. Just stay right in the middle of the fat and fill it evenly. Next, here's a vaser step. See, she's fully tumesced right now. And you see her abdomen is quite rigid. Oh, okay, we'll go to the vaser step in a minute. But you saw at the end how the fully tumesced abdomen looked. Now we're going to do the vaser step. We've got a skin port in, and that's going to be a little plastic screw-in device that you can see right there. And as we pass the probe in and out, it goes in fairly effortlessly. And what you're going to see is as we take these nice long strokes, just like we did through that piece of fat, look at that liquefied fat start pouring out of the ports. And again, we're going to do very long, smooth, even strokes back and forth, covering each quadrant. How much do? We do 1 minute of vaser stroking for every 100 cc's of tumescent anesthesia we put into that region. Again, we're doing some more down in that area as well. Finally, once we've done our vaser step, which is about 20 to 25 minutes, depending on how much fluid we put in, it's all protocol-based. The last part is the suction. And compared to traditional liposuction, which can be quite tiring because you're ripping and avulsing the tissue out, with this particular procedure, it goes quite smoothly because you've already liquefied the fat. We're using the 3.7 millimeter Ventex aspirator, which is the middle one. And look at the other difference in technique. Your hand is flat on the skin. You do not have to lift and make tunnels so that your avulsing cannula can do a better, more efficient job, because really all you're doing is cleaning up the puddles that you've made. And if you can see, the fat that's rolling down the tubing is bright yellow. There's very little blood in it. I joke with the patients that they lose more blood in the pre-op blood draw. And look, I'm holding the probe with just a thumb and a forefinger there. So you can see that the suction phase really is not that difficult to do. But I joke with the patients, yeah, you lost more blood in your pre-op blood draw than you're going to lose in this entire case. And again, the aspirate flows. It's formed fat along with some liquefied fat. It leaves in very rapid, voluminous amounts. And how much do? Basically, you just go into a quadrant and you take out basically the fat until it doesn't want to come out anymore. For a patient like her, who was only about 140 pounds getting her abdomen done, we'd probably take out about 300 or so from each lower quadrant, maybe take out 200 from each upper, and then reassess. There's some more strokes using, again, that flat hand on the skin. And as long as you do those strokes nice and even, smooth, and you keep them fairly parallel, you get a good job done. There you can see the aspirate forming in the suction canister, and you can see it's virtually all fat. There's just a tiny little bit of fluid that you may see collect down at the bottom of the canister. And now here's the end of the case. How do you know when this is actually the middle of the case. You can see we've done the right side, and see how thin she is on the left side, rather, where we've done, and on the right side where we have not done. Here's the end result. The abdomen has a nice concavity to it when she's lying down. And when you do a pinch test all around, it's basically fairly even everywhere that you go. And that's it for the video. And there's her before and after. And so right before the case, we took the picture on the left-hand side, and you can see kind of the dome-shaped abdomen. And then immediately after the case, we stood her up. Now, you can't do that if someone's asleep. So it's great. She was wide awake. We could stand her up, take a look, make sure there was nothing uneven. And you can see what an incredibly dramatic difference you can get in a patient in just a couple hours of work. So we'll clean her up and put some padding over the incisions, slip on her garment, and she's ready to get a ride home and be wide awake the rest of the day and enjoy her family and have a nice, very predictable recovery. Next. Well, that's it. So Christy hopefully has been compiling some questions. And so feel free, if there's anything you want to ask, anything that you have any doubts about or questions about, definitely go ahead and type them in. And we'll go ahead and answer. I see one question that popped up on the screen earlier about what effect does prior liposuction have on this procedure. And it's a pretty variable effect. I've done a number of people who've had prior cases before. Either they've had laser, vaser, or old-fashioned lipo. And I must say that when doing the vaser the second time around, it's pretty smooth. You don't get a ton of scarring from a prior case. And so you may need to use a little bit more of an aggressive probe at first to help get through some of the connective tissue. So you might have to use a one-ring probe instead of a two-ring probe when you're doing the vaser. But by and large, the vaser does a great job of finding those little pockets and areas of trapped fat that maybe made that first liposuction case kind of irregular. Because remember, when you're avulsing the fat, when you're ripping it out with a sharp cannula, you're making tunnels. And again, that cannula is going to always want to go into those same tunnels. But when you pass in and out with a vaser, even if you pass in that tunnel where there's no fat, because of all the energy emanating from the sides of the probe, you're going to get that little nodule of fat that's tethered that you have a hard time nailing with just a plain suction cannula. So you're going to get it from the side a little bit, and you're going to begin to emulsify it, and then that's when you get the smoother results. So definitely prior liposuction, prior surgery is not a contraindication at all. And we've done plenty of people with prior low transverse incisions and midline incisions, and the vaser does a great job undermining those scars and releasing those scars. And if the scar is extremely thick and cannot be released, you just vaser right up to the scar on each side, and by lowering the concentration of fat, that sunken scar looks flat because the fat's not bulging up from around it. Let's see, another question.
Looks like the next one is, and I'm going to expand upon this one, was how is laser or smart lipo impacting basically vaser? This physician feels that patients are always wanting the newest, latest procedure. So, Dr. Zenger, if you could go into what you've experienced in laser compared to vaser as far as patient demand, and what you've experienced from a clinical endpoint comparing vaser to the laser lipolysis procedures.
We're beginning to have a lot of patients. And I don't know. I'm speaking, for our area, but we're beginning to have a lot of patients who are getting consults for laser. The one question they're coming in and asking me first is, how much fat can you get out? And word is starting to get out because there's been this critical mass of laser patients that have, although the case went very well and they had an easy recovery, they just didn't get out a whole lot of fat. And so what we're finding is that people want, if they're going to take a day out of their schedule and pay this kind of money, they want a lot of fat out. I mean, here in the South, most of my patients are BMI, 27, 29, something like that. I mean, typically these are not 24s, 25s that need that real subtle body sculpting and only 600 cc's out. I mean, these are people that generally need 1,000 or more cc's out. And so, simply all I have to do is sit back in my chair and say, well, look, we can easily get out that much fat on you, and I have no doubt we're going to get out a significant amount of fat. I never promise a specific amount, but, we quote typically that you are going to lose on your pinch test. Generally speaking, you're going to be pinching half or less than half of what you can pinch right now. So they definitely like that response. Also, I don't know, in my area, a lot of docs have been burned with very, very high-priced lasers, and so they are charging an awful lot amount of money compared to our costs, which are lower with this equipment. So, that is a help too, although I tell people you never really want to compete on price. Simply put, the price that we're very comfortable at is the one we charge, and we're still beating the competition. Another thing, that I've done, because I was curious about the question too, is there are some websites where you can go and look at website traffic, and I've noticed that website traffic for some of the big laser companies is kind of leveled off, and the website traffic for vaser.com has steadily increased, and the gap's getting actually quite narrow, and Vaser's done a great job of getting their name out and marketing. But the bottom line you need to think about is what tool is going to work best in your hands. What tool is going to get the job done safely, predictably, with a very, very short learning curve. And with ultrasonic, you're taking heat and the potential for burns almost completely out of play. I'm not going to say completely out of play, as opposed to laser where heat is definitely a major mechanism of action. So you need to look at that too. But in general, I think we've started to see the newest, coolest aspect of laser leveling off a good bit. And I know from the number of doctors, too, that started out with a laser and now have wanted to add vaser to that so they can actually debulk significant amounts of fat. Really, the laser is used more on the side, and the vaser has become now the workhorse. So I hope that answered. I kind of was all over the place, but...
Dr. Zengo, another question here. Do you see skin tightening after a vaserlipo procedure?
Yeah, we do. Skin tightening is really become a buzzword for marketing, amongst all the technologies. And skin tightening is achieved in a number of different ways. Skin tightening is achieved by first picking the right patients. And people that have some degree of stretch marks still will have some good skin retraction. Obviously, people who have lost 200 pounds and have draping skin that drapes like draperies do in your house, that's a different story. But so picking the right patient and also wearing the garment for a proper amount of time after the procedure, I think, is really, really important too, and you've got to stress that on the patient. But finally, with this technology, I have experience doing these cases with plain cannulas as well. And I will say, beyond the shadow of a doubt, when you do a vaser case, you get a much smoother looking skin tone and texture at all stages of the recovery compared to the avulsive sharp liposuction. And I'm not going to say I'm smart enough to know exactly why, but it has to be the use of the ultrasonic energy and the sparing of the connective tissue. And that is what really has impressed me for someone who's been on both sides of the fence, doing it the traditional way and doing it the vaser way. So if you've got those borderline patients, obviously if you've got someone like that model who was in the first picture, she's going to have pretty good skin retraction no matter what you do, as long as she wears her garment. But for those typical 2-3 children, working moms, the vaser is going to be that difference from a good result to a great result.
Great. Another question here. How much fat would you expect to get based on your pre-op expectations of the patient? What do you tell the patient to expect during your initial consult? And do you typically recommend that they lose weight prior to the procedure for the outcome to be optimal?
Well, those are three really good questions, and we probably spend about 20-30 minutes in our training course going over this. But in general, the amount of fat you get out is very, very hard to predict because it does vary somewhat too on the amount of tumescent fluid that returns into your canister, and that can depend on how much tumescent fluid you put in. So I try not to talk too much about how much is going in the canisters. We always tell people we're going to get out just about everything we can. So how much do you typically get out, just to be on the ballpark for a 160-pound, 5'4" woman abdomen, you're going to get somewhere between, somewhere around 1,500 cc's out of a person like that if you're doing full abdomen, maybe with a little spillover into the love handles. But I really don't want to get them to expect a certain amount of fat. What I do want them to expect, though, is when you pinch that fat, how much less is that going to be? Because you can take a tape measure and wrap it around, but that's unpredictable because that can depend on where they are in their menstrual cycle, what they just ate, bloating and gas and all that stuff get measured as well. But when you do a caliper and you actually pinch the fat, that is really a reflection of everything that you've done. So what I usually tell people is see the amount we're pinching now, I will get that to be about half of what we are pinching at least when we are done, and I'll probably exceed that. And for a lot of people, that when you show them that smaller pinch, they really seem to appreciate that a little bit more. About losing weight prior to the procedure, that's a tough one. If their BMI is above 30 prior to the procedure, I really want them on a good nutrition weight loss program, kind of long term. Unless they are prepared to do the vaser in staging, meaning they're prepared to do one case and then maybe do a second case in the same area, say 6 to 12 months down the road. And if their abdomen is really, really big compared to the rest of their body, they may need that staging case. What I don't want is a patient to go on a real big crash diet a month beforehand malnourish themselves, and then get a procedure done, which requires still a little bit of healing. I mean, it is a cutaneous surgery, which requires healing and good nutrition to heal nicely. And I'm afraid those people that do stimulant diet pills and starve themselves to try and get their weight down are not going to be as happy with the results, because, as we all know, people rebound after that. And the last thing you want is a patient gaining during that first month of recovery. And all the surveys show the differences in satisfaction rate with any kind of liposuction procedure hinges mostly on the patient's ability to maintain their weight. So I find it very, very important that patients can have control over their weight. For instance, a typical patient who comes in who's at her all-time high, who was 10 pounds lighter the year before, 10 pounds lighter the year before that, and her weight is out of control, and she has no ability on how to even stop the gain, let alone start losing. That patient really needs to be put into a weight loss protocol first, get control of her weight, and at least get it to the point where she's not gaining anymore before doing the vaser procedure, or any lipo procedure for that matter. Because when all is said and done, they lose a tremendous amount of volume, but in that canister, it may only be about a pound. So any patient that comes in who's really, really asking a lot about how much scale weight they're going to lose, I need to redirect them and talk more about how their clothes are going to fit, how they're going to look in their clothes, and how that area is going to pinch.
Great. A follow-up question to that one, Dr. Zengo. How do you determine what is omental versus dermal fat from a pre-op diagnostic perspective, and what is the yardstick?
Well, one of them is, do you have a Y chromosome or not? If you got a Y chromosome, probably a lot bigger proportion of it is omental rather than dermal. But the more scientific way is, again, the calipers. And if you can pinch it, you can get it. And so what you do is you view the patient from the side, you gently press inward, you go to the left or the right of the navel, and you gently press inward until you feel the fascia and the rectus muscles. And then by looking from the side, you see, well, where's the tip of my finger with regard to their body contour? And that's how you can get a feel for, is their fascia or muscle layer bulging beneath all their dermal fat or not. Now, most people will have a little bit of bulging of the rectus muscle and the rectus fascia in that area. But if you've got a guy with a big beer belly spilling out over his belt, and you go push in, and it's hard as a rock, and you try to pinch and you can't pinch anything, then you realize he needs a diet. He doesn't need lipo because all of his fat is internal. So the main thing is pressing in on the fat and trying to pinch. And for most women, if you can pinch more than an inch, then, or even if you pinch an inch itself, she's a great candidate for a procedure like this.
Great. We have another one here. It sounds like vaserlipo is good for these larger volume areas. Can vaserlipo also be used to treat small areas?
Definitely. And my favorite area now to do vaserlipo on is actually the saddlebag area of the leg. And our most common patient there is about 5'0" and 115 pounds. And these are patients that are just disgusted with the fact that they have to buy size 6 jeans because of the tremendous width of their hip area compared to the rest of their figure. And so the saddlebag region is actually quite small. And if you took your thumb and your forefinger and joined it together on both hands and created an oval, that's about how big the area is. And it's quite a precise area. And you can use the smallest vaser probe, and you can use the smaller suction cannulas and do a really nice job and get some really small little incisions. Actually, one trick that's neat for the infusion and for the suction stages, you can actually just use a dermal punch as a incision for the smallest vaser instruments, and that dermal punch heals very nicely on its own as a little kind of faint white spot. And so it doesn't even really look like they had surgery. It really kind of just looks like a freckle. So definitely, and there are people that are doing vaser very successfully on the chin and the neck. I don't do that area yet, but inner thighs is another very dainty area that you can do very nicely with the vaser. You really only need the one incision for the vaser on each leg, and fan out from there, and that works pretty well too. The back actually is, in a lot of cases, a lot more shall we say, I don't know how we would call it, but the back is not one sheet of fat like the abdomen is. It's actually many little oval compartments. If you can picture a woman with the bra line, under the bra strap is one component. Then there's another roll right below that. Then there's another roll right below that. And then at the area where the bra strap wraps around the rib cage, there's an area of fat there right below the armpit. That's another little island. And then as you go up from the main bra strap up to the shoulders, there's a couple other little circles of fat there. And the key to doing a back is you want to do each of those little circles as each a little 50 or 100 cc case. And they all blend together to give a result like that lady you saw earlier on.
Wonderful. Well, that concludes our question and answer session this evening. On behalf of Sound Surgical Technologies, I'd like to thank you all for attending the presentation. Thank you, Dr. Zengo, so much for your time as well. Just to give you a few last-minute pieces here, if you'd like any additional information on vaserlipo, please feel free to visit our website at vaser.com, or you can call our toll-free line at 888-471-4777, and we'll be able to direct you to the appropriate person to answer your questions. In addition, if you'd like more information on practical CME training with Dr. Zengo, you can visit that website at practicalcme.com. Thank you all, and have a wonderful evening.